Welcome to Health Champ, your source of a wide range of health tips and hacks. The pandemic isn't over yet, at least at the time we're producing this video. Here are 10 things to do and avoid to keep yourself safe and away from the deadly virus. Number 1, stay home. There's no place like home. At home, you are in control of the many things that can be used as a barrier and shield, both figuratively and literally, to protect yourself from this global pandemic caused by the SARS CoV-2 virus. You can control, monitor, and manage the activities that go about the four corners of your property. Because the virus is out there, it is safest to stay inside your own home. Stay home means, you don't visit other people's homes, and you don't let other people in your home too. This is a pandemic, and the latter is not done out of disrespect or untoward finicky response to the global situation. Keeping others out is not only for you, it is also for them. We are in a battle with an unseen force. Who knows? You may be asymptomatic and can in fact, pass on the virus to them. Number 2, boost your health. We are in a pandemic, the unseen enemy could be lurking in the shadows, and the best way to aid your act of contributing to the world by staying home, is to boost your health. On top of a healthy diet, and as recommended by your dietitian or your doctor, take vitamins. Until we, as a human race, can successfully produce an effective vaccine for COVID-19, we need to rely on what keeps our bodies in top condition to combat the virus. Take vitamin C, which helps quickly arrest inflammation and fight colds. Take enough vitamin D to prevent respiratory tract infections. A healthy dose of vitamin B6 and zinc also helps boost your immune system, treat nasal congestion, and resolve cough, which are symptoms of COVID-19. Drink lots of water. Consume at least 2 liters of water during the day. While there is no hard evidence that water can flush the virus out of your system or that the acid in your stomach could neutralize the virus, staying hydrated is essential to keeping a healthy body. Getting enough sunshine in the morning, between 7 a.m. to 10 a.m., also helps boost your immune system. Number 3, wear a mask. Unless absolutely necessary, stay home. But there are cases when it's just not possible to keep on staying home. If you really have to go out, wear a mask. And not just any mask. Wear either a surgical mask or the N95 mask. The latter is most preferred as it can trap 95% of small aerosol particles. Studies found that these droplets can float for as long as 3 hours. Who knows? Because the naked eye can't see them, you may be walking through a cloud of droplets. So if you decide it is necessary to go out, wear a mask. While it is recommended to replace your N95 mask after 6 to 8 hours of use, there are ways to sanitize it so you can reuse them once or twice more. One of the 4 ways that researchers found to be effective in eliminating the virus is by exposing the mask to UV light for at least an hour. Number 4, wear a face shield. Remember, if this wasn't a dangerous and lethal virus, it wouldn't reach all corners of the world, bringing economies to their knees and sending thousands upon thousands of people to their graves. As of the time this video is being produced, there have already been 180,000 deaths in the US alone and over 800,000 worldwide. So we need to protect ourselves as best we can. You have your mask on, now wear a face shield. Some wouldn't even consider it because they find that it's an exaggerated reaction to the situation, or that it looks funny, but hey, it's a pandemic. Any day in these days is not your ordinary day. We are under attack and the virus can get to your eyes and not just through your nostrils and mouth. Give it your best effort. Looking funny is not our concern right now. Number 5, avoid confined spaces. Actually, open spaces give you wiggle room to dodge the virus. Larger particles can't suspend for a long time in air, smaller particles can float for about 3 hours, but you can filter that with an N95 mask. The virus is also very sensitive to hot temperature, and keeping your distance from people can help evade it. If you need to go out for the essential activities, avoid confined spaces. Unlike open spaces, the wiggle room is gone. Also, air conditioning units circulate the air, and in confined spaces, you would pretty much be inhaling the same air other people exhaled. Over and over. In truth, the ventilation systems in confined spaces only increase the risk of transmission. Number 6, always keep your distance. Studies by the Center for Disease Control and Prevention in the US recommend a 6 feet minimum distance from other people. Keeping your distance from other people at this length though doesn't mean that you'll be safe without a mask and face shield on. Never let your guard down. Number 7, move about. While no study confirms how much aerosol particles you need to inhale to get infected, scientists and medical researchers believe that you need to be in close proximity, less than 6 feet, to an infected person for about 15 minutes before you get infected yourself. So move about and don't stay stationary, especially when there are other people near you. Again, never let your guard down. None of these points we have identified here, on their own, acts as a standalone measure. These points complement each other, and any one point mentioned here should be practiced with all the rest. Number 8, avoid public toilets. If you absolutely need to be out and about, make sure to have planned everything out in advance so you spend less time dodging the virus. The more time you spend outside, the more risk you engage. The plan includes unloading for when nature calls. Make sure to empty your bladder and bowels so you won't need to use public toilets. There are plenty of reasons to avoid public toilets. First reason, you have no idea who's been in that public toilet. Second, it's kind of a confined space and infected aerosol may be floating there. Third reason, the virus can linger in plastics, such as toilet seats, for over 72 hours. Fourth, toilet doorknobs and steel handles can be harboring the deadly virus, and it can linger there for over 48 hours if not recontaminated. Fifth reason, the virus may be spread from fecal matter. When you flush feces down, particles can shoot up in aerosol form as high as 3 feet. Lastly, studies have found that in the hospital rooms of COVID-19 infected patients, over half of the many things the patients use and touch in the toilet have the virus. Number 9, treat everything as contaminated. So, you decided to just stay home. And for the supplies, you availed the home delivery services. What to do now? Delivery services almost always have cashless transactions. Choose one that offers this. While most trusted companies sanitize their products and packaging, and even exercise measures to make sure no virus is transmitted, it will be helpful if you too exercise some precautions. The only way to truly keep the virus out is to treat everything as contaminated. When receiving the items, ask the delivery crew to leave the package at the front door so you eliminate the possibility of person-to-person transmission of the virus. While studies show that the coronavirus doesn't linger for much long on cardboard material, just throw the cardboard packaging away to be sure, and then sanitize the contents. Sanitize items that can be washed with water and soap by wearing gloves and scrubbing gently with your hands for no less than 20 seconds before rinsing. For items that cannot be washed, use a UV light. Alternatively, you can use 70% alcohol to wipe surfaces with. If you can find 80% or even 90% alcohol, they are better. Another alternative is using sodium hypochlorite. The World Health Organization, on their COVID-19 Q&A page recommends a solution concentration of 1,000 parts per million. For example, 1 part of 5% strength household bleach mixed with 49 parts water. For food deliveries, the same is applied. Throw whatever packaging that's not essential, and transfer the food to a microwavable container or plate. Heat it up in the microwave oven as desired or as necessary, knowing 40 seconds is enough to kill the virus. The same goes for you and your things. Again, treat everything as contaminated. When you return home from essential activities outside, like doing groceries, leave your shoes to bathe in the sun, sanitize your keys, wallet, bags, wristwatch, and everything else you brought with you. Separate the clothes you wore at home from the ones you wore outside by putting the latter into a separate hamper dry so they don't get mixed. You can also hang these clothes outside to let the sun's UV light and heat work on them to kill the virus, if any got onto them. And, don't forget to shower immediately. Number 10, treat everyone as a carrier. There are many asymptomatic carriers out there. You wouldn't know if you're next to one. And even when people get tested and the results are negative, they can still get infected immediately, right after the test, and won't turn up positive until after roughly 10 to 14 days. Because of this time delay caused by the incubation period of the virus, and also because there's no real-time way to tell who's a carrier, you will just have to treat everyone as a carrier. That's crazy, right? But these are crazy times. Desperate times need desperate measures. No hugging, no touching, no kissing, not even a peck on the cheek. Not even for your closest of friends, not even family or relatives you happen to chance upon when you are out for essential activities. Remember, it's not about being rude, it's about keeping everybody safe. In fact, as you treat everyone a carrier, they should treat you as one too. In the same manner, to keep them safe because you might be an asymptomatic carrier yourself, keep your distance. When you chance upon them, just say, "I might be a carrier." That should not sound rude. Remember, these points work hand in hand with each other, and not as a standalone measure independent of the others. Keep safe, and never let your guard down. If you learned something new, please hit the like button below. For more health tips, tap or click the subscribe button. While you're at it, ring the bell button to get notified when we post new videos.